Hello everyone. Today we will discuss about puerperium. So what is puerperium? It is the period from which the placental expulsion to 6 weeks of postpartum. There will be reversal of physiological changes that happened during pregnancy. Then establishment of lactation will happen. Restoration of the reproductive and other systemic functions after pregnancy. Physiological changes that happen during this time. First one is uterus involution. The weight of the uterus will be immediately after delivery is around 1 kg. Weight by 1 week is around 500 grams. Weight by 6 weeks is the 6 to 80 grams. The fundal height falls by 1 to 2 centimeter every day. There are three types of Lochia. Lochia rubra, which is produced in the first 4 days, then serosa 5 to 10 days, and then alba up to 6 weeks. The cervical, vaginal, and pelvic floor changes. In cervix, the external os partially closes, canal reduces in size, os becomes a slit-like opening. In vagina, the gradual restoration of tone, rugae appear by 3 weeks. Pelvic floor, the muscle tone gradually improves. Risk of relaxation if trauma, there is a risk of relaxation if trauma has occurred. Endocrine changes. As far as estrogen and progesterone is concerned, there will be a rapid fall after the placental delivery. It initiates the lactogenesis. Prolactin rises in the postpartum period and it is maintained by suckling. This inhibits ovulation and supports the milk production. Oxytocin, it is increased with the nipple stimulation and milk ejection reflex promotes the uterine contraction. Cardiovascular and hematological changes. Blood volume. It falls due to diuresis and blood loss. Cardiac output returns to normal by 2 weeks. Leukocytosis is common in the first few days, and it is the hypercoagulable state persists, increasing the risk of DVT. As engorgement of breast happens in the first 2 to 4 days. Transition from colostrum to mature milk. In case of urinary and GI, postpartum diuresis is very common. Transit urinary retention may occur. Bowel motility is sluggish initially. What are the routine postnatal cares that needs to be imparted? Monitoring the vital signs like pulse, BP, and temperature. Uterine assessment like a fundal height monitoring, involution, and lochia. Early voiding and fiber-rich diet to promote bowel and bladder care. Early ambulation to prevent DVT. Nutrition should comprise of high protein as well as adequate hydration and perineal hygiene through sitz bath and cleanliness. Complications of puerperium. There could be puerperal sepsis, secondary postpartum hemorrhage, thromboembolic disorders, breast complication, urinary system complications, wound and perineal complications, including subinvolution of uterus, and postpartum psychiatric disorders. What is puerperal sepsis? Puerperal sepsis is fever greater than 38 degrees Celsius occurring on any two of the first 10 days of postmortem, excluding the first 24 hours due to genital tract infection. Usually, it is mixed aerobic and anaerobic flora. Includes Streptococcus pyogenes, Streptococcus aureus, E. coli, as well as anaerobes. The risk factors include prolonged labor, premature rupture of membrane, multiple vaginal examination, cesarean delivery, anemia, and poor hygiene. Clinical features consist of regular fever, pelvic pain, foul smelling lochia, uterine subinvolution, tachycardia, and uterine tenderness. Complications include parametritis, pelvic abscess, septic pelvic thrombophlebitis, peritonitis, septicemia, as well as shock. Initial assessment includes temperature, pulse, BP, and respiration. Uterine tenderness and lochia characteristics has to be noted. Check for breast infection, UTI, or any wound infection. CBC, CRP, blood cultures, and urine culture has to be done. High vaginal swab as well as ultrasound pelvis if retained products of suspected after the pregnancy in the postpartum period. Coming to the resuscitation and supportive care. So IV fluids usually crystallize to correct dehydration and maintain perfusion. Oxygen if required to maintain saturation of greater than 94%. Antipyretics to reduce the fever. Strict input-output chart to monitor renal function. Monitor vitals every 4 to 6 hours to detect the sepsis for 7 to 10 days. Source control. And there should be retained products of consumption. Surgical evacuation like a DNC and DNA under antibiotic cover should be done. If the underlying cause is pelvic abscess, image guided drainage needs to be done. For wound infection, debridement and dressing. and perineal wound breakdown, secondary suturing after the infection control. Septic pelvic thrombophlebitis should if there is septic pelvic thrombophlebitis, heparin therapy should be initiated. Secondary postpartum hemorrhage. It is the time period after 24 hours to 6 weeks postpartum. Retained placental tissue, subinvolution, infection like endometritis and coagulation disorders, as well as uterine artery pseudoaneurysm are the causes. Usually it presents with a heavy or recurrent bleeding, pelvic pain, fever, uterus larger than expected. Initial assessment include ABC stabilization, that is airway, breathing, and circulation. Check vital signs, pallor, uterine size, and tone. Inspect the lochia, vagina, and cervical tears, and episiotomy site. Blood investigations include CBC, coagulation profile, blood grouping, as well as cross matching. Ultrasound pelvis for retained products. Resuscitation include two wide-bore IV cannula wherein there will be rapid fluid administration, crystalloids like NS and RL to restore intravascular volume, blood transfusions if hemoglobin less than 7 gram per deciliter for active bleeding to maintain oxygen carrying capacity, oxygen supplementation to prevent hypoxia. The uterotonics are the mainstay of treatment. So 10 units of oxytocin IM or IV infusion is the first line of treatment. Ergometry zero point 0.2 milligram IM or IV, but it is contraindicated in hypertension. Misoprostol 600 to 800 microgram per rectum, useful in low resource settings. Carboprost 250 microgram IM repeated every 15 to 90 minutes to be avoided in asthma. Treating the underlying cause. So the retained placental tissue, evacuation of the retained placental products under antibiotic cover, ultrasound guidance if needed. For subinvolution, ergometrin regimen for 2 to 3 days, followed by antibiotics. Infection control include broad spectrum antibiotics of clindamycin, gentamicin, and metronidazole. Treat the sepsis as per the protocol. Uterine artery pseudoaneurysm, suspect if recurrent, painless, brisk bleeding is there. Uterine artery embolization is the treatment of choice in case of uterine artery pseudoaneurysm. Coagulation disorders, for this, replace with clotting factors like fresh fluorescent plasma or cryoprecipitate, then manage the primary disease for ITP, DAC. Surgical management, only if bleeding persists, balloon tamponade, uterine artery ligation, internal iliac artery ligation, or hysterectomy should be considered as the last resort as a life-saving thing in intractable bleeding. Thromboembolic disorders, DVT, PE, ovarian vein thrombosis, hypercoagulability persist during postpartum. Management include Doppler, low molecular weight heparin, as well as hydration. Breast complications include engorgement of the breast, cracked nipples, mastitis, and breast abscess, for which frequent feeding and warm compression in case of engorgement, correct position and latching for cracked nipples, antibiotics, and continued breastfeeding in case of mastitis, and incision and drainage for breast abscess needs to be done. Then postpartum psychiatric disorders include postpartum blues, which are very transient, depression that requires therapy or medication, and psychosis, which requires emergency referral. Immunization and contraceptive, TT booster if needed, and contraceptions, LAM, progestin only pills, DMPA, IUCD at 6 weeks, and barrier methods. So to summarize, Puerperium is a 6 week period beginning immediately after delivery to 6 weeks. Reproductive organs and maternal physiology return to the pre-pregnant state while lactation becomes fully established. This phase involves major adjustments in multiple systems, including uterine involution, endocrine shifts, cardiovascular normalization, changes in the uterine and GA systems, functional transformation of the breast. Puerperium requiring careful observation for warning signs such as abnormal lochia, delayed involution, fever, excessive bleeding, and mental health disturbances. Effective management of the puerperium combines routine postnatal monitoring, early mobilization, perineal care, breastfeeding support, adequate nutrition, timely immunization, and contraception counseling. Prompt recognition and treatment of complications, especially for puerperal sepsis and secondary postpartum hemorrhage. I hope you have learnt through this presentation. Thank you for